What's up, y'all? This is Not a Real Doc DPT, and in this video, we're going to be taking or going into a series that I've been starting called Behind the Doctorate. And for all the videos that you see that are going to be listed with this as part of the title, these are going to be videos that are more student physical therapy based, with the mindset and the idea of trying to help um, just students in their kind of journey to progress from where they are to becoming doctors of physical therapy. So normally this channel is more kind of physical therapy with a patient focus, and trying to help with a looking at things from a patient mindset and what can help them. But in these particular videos, I wanted to more talk directly to student physical therapists out there. So today's topic, we're going to be talking about what is the best area for you as a student PT to look to start within to get your career going as a doctor of physical therapy. Um, so that is going to depend on what your interests are. That really is probably your main concern. If you have a desire to be a part of a particular specialty within physical therapy, like let's say you're wanting to go into pelvic health or women's health, or maybe you're wanting to do peds work, or one of the PTs or this one of the fellow students when I was in my doctorate program, she wanted to go into home health and knew that from the get go that that's what she wanted to do. So if that is your mindset, if you already have a particular area within physical therapy targeting, then highly recommend that you do everything you can to go in in that direction. Your rotations, the ones that you have an effect on and can determine where you're going to go, should be directed on whatever field or area of that specialty that you're wanting to go into. So, actually, in home health, normally in home health, they are wanting to hire people who actually, or PTs that actually have experience already. And just because the girl that I was mentioning, because she was interested in home health, she set up her final rotation to be a home health rotation. And because of that, the company was so impressed with her that they kind of waived the need for experience in her case, and were able to hire her directly from being a student and a new grad right into being a full-time physical therapist with them. So there can be benefits to focusing your experience as a student physical therapist on those fields that you know that you want to go into. Okay, so that's the first thing. If you know where you're going to go, and you're set that this is why you went and got your doctorate, because you're wanting to work with peds, okay, then that's where you need to go. All right. So the rest of this is not for you. For everyone else, um, if you are undecided, you're not exactly sure, you need to go to outpatient. The vast majority of physical therapists or doctors of physical therapy graduating, you need to work as an outpatient physical therapist. You need to do that for somewhere probably at least between about 1 to 3 years, somewhere in that direction, because you are going to learn things in the outpatient field that you then will be able to apply to any other area of physical therapy for the rest of your career. Okay. Um, so that's going to be, well, being an outpatient, it's going to help you um, across a multitude of areas. It's going to give you that experience to work and relate with patients. It's going to teach you how to be an authority figure. It's going to teach you to think on your own. And it's going to help you to apply the concepts that you've taught and that you've learned in school to all varieties of patients that have all sorts of disorders, disease states, injuries. you're going to run the gamut. Outpatient, you will wind up seeing people who've had strokes. You'll wind up seeing motor vehicle accidents. You'll wind up seeing amputees. You may see a little bit. You may see a paraplegic or something like that. I saw a few of those and have seen a few of those, but um, you also are going to be working with your general pain patients. It's going to teach you to work with patients, to think, to go through the process that you've learned and apply what you've learned to the patients so that you can help them. And it's going to do that in a way that no other um, area in physical therapy is going to teach you. Like I like to kind of equate working in outpatient physical therapy. It's almost kind of like the Wild West. Like the outpatient physical therapists, they are the ones that are going to typically be more on the cutting edge of what the most up to date research is saying. They're going to be the ones doing the most up to date manual therapy techniques. They're going to be the ones applying just the different modalities at different times. It's more of what physical therapy actually is. I would say in my mind, when you go into some of these other specialties, like home health, for instance, it's very different. It's you're not going to do those same things. And if you go into skilled nursing, and when you first graduate, you're not going to be pushed in the same way that you are an outpatient. And another reason that you need to go into outpatient first, as soon as you are a new grad, is you're going to find it really hard if you start, say, in skilled nursing. And let's say you're in skilled nursing for 3 years, and then you want to leave skilled nursing and go into outpatient. That's going to be really hard. That your opportunities in the future are going to be limited if you do not start an outpatient. As I say, if you're somebody and you know that you want to work in women's health or pelvic health, who cares? You don't really, you have no interest in working anywhere else, so it doesn't matter. You know where your focus is. But if you're still wanting to kind of stay broad and consider, to try to see where you're going to fit, in your career, you need to go to outpatient. It's going to give you the experiences that you're not going to get in any other setting. And hiring clinicians in the future, the future managers that you might would interview with, they all know this. That's why it makes it really hard if, let's say, you were working in an acute care setting, also for 3 years or 5 years, and then you try to move into outpatient. You're going to get a lot of people that are going to pass on you. Matter of fact, one of my managers, when I was working with a different or another company, actually even said that anybody that if he was looking on someone's resume and they had another field in physical therapy on their resume trying to come into outpatient, he just threw it right into the trash can. Doesn't even consider them. So do take that into consideration. So I wanted to impart that with you, that because I think sometimes you think, well, I'd like to start over in skilled nursing and work there for a bit, and then maybe I'd go to outpatient or something. Don't do that. You're going to sabotage your career. The also another reason. Well, let me come back. One of the big reasons that the that manager felt that way to say that he's going to toss your resume in the trash if you were coming from a different field in physical therapy trying to get into outpatient. It's because of what I mentioned a little bit earlier. They don't feel that you're using your skills well. And I think you will feel, as somebody that has worked in multiple areas of physical therapy, that when you're not working in outpatient, I think you do feel that your skills kind of suffer a little bit because your patients become less diverse as far as what you're treating. You're not pushed as much. Oftentimes, you might not have as enough time to do manual therapy treatments. You might be in a situation where that's not even relevant. Like you working in a hospital, the vast majority of those patients, why would you do manual therapy? There's no need for that the vast majority of the time. So it's because that's the impression that if you're coming in from another field into outpatient, you're coming in with poor skills or rusty skills. That's the reason that they're feeling that way. So if you are wanting to have the most broad place to start with your physical therapy career, no question, start with outpatient. Do that for about 1 to 3 years and then go from there. But if you already know where you want to go and you already are set on it, then great. That's awesome. Pursue that. And good luck to y'all. I hope that this has been beneficial to you. I'll be looking for other videos that I'll be doing in the future on this Behind the Doctorate series, where I'm just trying to impart just lessons that I've learned and things that have experienced for the last almost 12 years now of working in the field of physical therapy as a doctor or a doctor of physical therapy, but not a real doctor. So I hope you all have a good one. And if this has been beneficial to you, please hit the thumbs up button and give us a like, and subscribe to this channel if you want to be up to date on some of these future videos that I'll be doing. All right, y'all have a good one.